A new analysis from health policy experts finds changes to the Affordable Care Act marketplace under President Donald Trump's sweeping budget bill could mean nearly 2 million Texans will lose their health insurance. Joining us now is Gabby Birnbaum, a Washington correspondent with the Texas Tribune. Gabby, thanks for joining us.
Thanks for having me.
So talk to us a little bit about this analysis. How exactly was this done?
Yeah, so I think you have to sort of work backwards. Right now, there are almost 4 million Texans that are enrolled through insurance through the ACA marketplace, right? And so they're projecting that 1.7 million will end up dropping their coverage due to two different changes. One is the expiration of a tax credit that drove down premiums. And when that was first passed in 2021, that's when we really saw expansion of the marketplace in Texas. And number two is changes that Republicans have made in their bill. That's just going to end a lot of the automation around the ACA. So you can't, automatically re-enroll. For example, you're going to have to provide additional documentation and verification more often than it is right now. And so they expect that a lot of people will end up dropping coverage just because they're not aware of the coming changes. Or, when you add bureaucracy, oftentimes people end up dropping, coverage in this case.
Yeah, and when we hear this, we know that Texas already has the highest uninsured rate in the country. Experts really say this could be devastating for a lot of people.
Yeah, this is a health system that's already under, enormous strain, as you mentioned. When you have a high uninsured rate, that's harder on hospitals to make sure that they get compensated for care. You have worse health outcomes for people. There's a lot of downstream effects. And so, yeah, when you're talking about something that's going to cause, over 1 million, close to 2 million people to lose coverage, that's just more pressure on hospitals, on insurers, because, the most likely people to drop their health care if it's unaffordable are people who are healthy, who don't feel like they need it. And so then the risk pool goes up for everyone left on private insurances. You've already seen, for example, Blue Cross Blue Shield, the biggest insurer in Texas, has requested a 21% premium increase for ACA compliant plans next year for people who get their coverage through the ACA marketplace. So that's just one example of how they're already pricing in what's expected to be, a massive coverage loss in the state.
Yeah, which can make it unaffordable for those people who are already struggling to get some form of coverage. What are we hearing from Republicans about this? I mean, there was so much mixed feedback on that budget bill initially because of some of the things surrounding health care, and it passed anyway. What do they have to say about this?
Yeah, in terms of the changes they made in the bill to the ACA, I mean, I think it's the argument they've been making. They feel like there's waste, fraud, and abuse, fraud in particular, in the ACA marketplace. They feel like people are getting plans through the ACA when they're eligible or claiming plans elsewhere, that there's too many people enrolled in the ACA who should not be eligible for it. And so that's, one of the reasons that they've said they want to implement more frequent eligibility and verification, shorten the enrollment period, make those types of changes. And then on the enhanced premium tax credits, those are those credits that Democrats passed in 2021 that have really driven down premiums. Those expire at the end of the year. So theoretically, there could still be a deal that Democrats and Republicans work out to extend those tax credits. But given that, they're costly, they have a high price tag, and the mood in Washington right now is so anti-spending, it's definitely going to be an uphill battle. But there have been a few Republicans who have expressed interest in working out some sort of deal.
Okay, which would obviously be, good news for people who are on the ACA. I was asking you what other things are Democrats doing. Obviously, that is a big one, trying to get that deal done. Anything else they have in the pipeline?
Yeah, I mean, right now, Democrats, are the minority in the House and in the Senate. It's going to be really tough for them to influence policy. But sort of finding a deal on the enhanced premium tax credits and thinking, what can we trade? If Republicans, support Democrats on extending the tax credit, what could Democrats trade, something that Republicans might want that they need votes for in the Senate? So that's the calculus that Democrats are weighing right now. Congress tends to never work unless there's a deadline. And so I would imagine if we see action on this issue, it'll be closer to the end of the year as the expiration date becomes a reality.
Yeah. All right. Gabby Birnbaum, Washington correspondent for the Texas Tribune. We thank you so much for your time today.
Thank you for having me.